welcome to this workshop. This is Kainara Mello, the idealizer of the Heart Diseases Prevention campaign that will be launched in São Paulo this year. I'll be explaining today about heart conditions and what you can do for yourself and what you can do to lower risk factors. First of all, have you felt any of these symptoms? Like chest pressure, pain, or discomfort in upper limbs, shortness of breath, or any other related symptoms as dizziness, sweat, indigestion, or nausea? If you have answered yes to at least 3 of these symptoms, you may be had or is having a heart attack. Not all heart attacks start with sudden chest pain. Symptoms may be milder and less obvious. Many people think, for example, that they have digestive problems. To be more precise, most heart attacks involve severe pain in the center of the chest that lasts more than a few minutes or that ebbs and flows. The pain or discomfort can be in one or both arms, back, stomach, neck, or jaw. And the shortness of breath may or may not be accompanied by chest pain. A heart attack happens when part of the heart muscle stops receiving blood because of a blockage. In a global perspective, men and women over 55 years old are more likely to have a heart attack. In our country, Brazil, heart conditions is the leading causal death, responsible for 30% of people from 29 to 55 years old. But what are the risk factors? They are smoking, increased cholesterol, diabetes, arterial hypertension, obesity, sedentary lifestyle, stress, and also depression. But if you are asking yourself how to lower your risk of having a heart attack, there follow some tips. First, control your blood pressure. High blood pressure is a major risk for heart diseases. It is important to get your blood pressure checked regularly, at least once a year for most adults, and more often if you have high blood pressure. Take steps, including lifestyle changes, to prevent or control high blood pressure. Keep your cholesterol and triglycerides level under control. High levels of cholesterol can clog your arteries and raise your risk of coronary artery diseases and heart attack. Lifestyle changes and medicines, if needed, can lower your cholesterol. Triglycerides are another type of fat in the blood. High levels of triglycerides may also raise the risk of coronary artery diseases, especially in women. Eat a healthy diet. Try to limit saturated fats, food high in sodium and added sugar. Eat plenty of fresh fruit, vegetables, and whole grains. The DASH diet is an example of an eating plan that can help you to lower your blood pressure and cholesterol, two things that can lower your risks of heart diseases. Get regular exercises. Exercise has many benefits, including strengthening your heart and improving your circulation. It can also help you maintain a healthy weight and lower cholesterol and blood pressure. All of these can lower your risk of heart diseases. Limit alcohol consumption. Drinking too much alcohol can raise your blood pressure. It also adds extra calories, which may cause weight gain. Both of those raise your risk of heart diseases. Don't smoke. Cigarette smoking raises your blood pressure, and puts you at higher risk for heart attack and strokes. If you do not smoke, do not start, please. If you do smoke, quitting will lower your risk for heart diseases. You can talk with your healthcare provider for help you in finding the best way for you to quit. But what do you do if preventing was not enough? First, when the first symptoms appear, call for help or go to a hospital immediately. The longer the delay, the greater the risk. If you are helping someone with a suspected heart attack, take a few precautions while waiting for medical help. First, lose the victim's clothing and keep him from making efforts. Second, do not offer anything to eat or drink or tranquilizers. And third, if the person passes out, check their breathing and pulse. In the absence of these vital signs, cardiopulmonary resuscitation maneuvers must be started immediately. And if you are the victim, please call 911 and protect yourself, protect your heart. You are also important. Bye bye. Thank you for watching.